ladies and gentlemen, completing to what the two panelists has already been alluded to you, I would suggest that we talk about what we have also here in Indonesia. So my talk will be towards the glory of Indonesian modern herbal drugs, herbal medicine, what we call OMAI in Indonesia. So before we talk OMAI, Indonesia, just like India, have Ayurveda and some other Unani medicine and so on. We have the tradition of jamu. Jamu is actually very, very good in terms of promotion, in terms of the prevention of health, prevention of diseases and so on, and has been used by over generational. In fact, there's a Western lady called Susan Jean Beers, who have already documented many of the use of jamu in the Indonesian population and also all over the world as ancient Indonesian art of herbal healing. Now here is the effect that we found here last year, even in December 2021, Nikkei Asia publication, a good publication from Japan, has already said that the jamu, Indonesian jamu, has starting to get trendy all over the world. It says the smelly, tastes weird, but yet it's trendy. In fact, Nikkei Asia showed that the sales of this jamu is going up and up and up, approaching to $1 billion at this moment. Now, but if you're talking about the use of traditional medicine in the hands of physicians, here in Indonesia, the allopathic physicians are the one who actually was supposed to prescribe also this herbal green pharmacy. Many of them is actually having still some suspicions because of some of the myth of the traditional medicine, having little no efficacy, absences of evidences, they don't have the correct diagnosis, or even they don't know the proper dosage to give to the patients and so on. So many of them are very uncomfortable prescribing in the mainstream medical setting in their facility. This is something that we need to combat. This is something that we need to make sure that the physicians do understand the importance, not only for the environment, but also for the health, that the green pharmacy, phytopharmaceutical product can also help the patient's health in general. So in the future, our model for the green pharmacy is actually an integrative medicine. So one can prescribe conventional medicine, just like the drugs that prescribe at this moment. They can also prescribe lifestyle medicine with the yoga, nutrition, sleep, stress, education, and so on. But also, do not forget that we also have green pharmacy, which also included in the complementary therapies. Now, the three areas, the three parameters will comprise the integrative medicine, which will make people not only stronger, but they are healthier, even though they have some diseases, but they can carry out the disease with a very good quality lifestyle. And if they prescribe integrative medicine rather than only curative medicine, human life will be much better, quality of life will be much higher. Now, in order to do that, again, we do not forget, and we keep saying to our doctors, pharmacists, green pharmacy is very important, especially phytopharmaca. Here we also not only benefiting the patients all over the world, in Indonesia, anywhere, but also the growers. Do not remember that these are part of the healthcare sector now, because they provide us with raw material for the green pharmaceutical product. Now, it is sad to say here in Indonesia, we have a lot of jamu, but again, the green pharmacy in terms of phytopharmaca, we have only 24. And this 24 is actually containing only like 7 to 8 molecules. We need to increase this so that can be used by different physicians all over Indonesia. Now, if you look into the statistics, and this is coming from the Kementerian Kesehatan, my apology for this is in Indonesia, this is actually the result of the research by the Kementerian Kesehatan, which is the Department of Health in 2019. Of all the hospital type B, C, and D, there are only 1.2% to 3% prescribing the green pharmacy product. Only 1.2% to 3% of the doctors of the prescription are belonging to the help coming from the natural product like green pharmacy. And if you look at the clinic, again, it's even lower. If this is going to a higher, it's TB, which is 5%. Here is 1.3% is the recept, is the prescription for green pharmacy products. So this is very sad for us in Indonesia because we have so much biodiversity and yet it's not being appreciated to the highest level in which it needs to be appreciated. So this is something we need to work on. So even though we say green pharmacy and the natural product, yet in practicality, Indonesia with the big biodiversity only prescribe 1 to 3 at the latest is 3% of all prescription. This is something that we need to work on. We need to change to increase the number of prescription in the hands of the doctor and the pharmacist to the benefit of the patients. Ladies and gentlemen, of course, we need to have evidence, like Dr. Fedia just alluded. The randomized control trial, systematic analysis, very important for the doctors to believe, for the doctors to subscribe the prescription of this green pharmacy product. Now, I'll give you an example. This is actually bark of the cinnamon leaves. This is bark of the tree coming from Mount Kerinci, which is a peak in the on the west of Sumatra here. And we have screened many of this cinnamon cinnamon basically, and all over Indonesia, also from Sri Lanka. We found out for our purpose, the Mount Kerinci one is actually suitable for the drugs. For example, we can make that drug, which is called Redacid now, for hyperacidity, also mucosal protection. And it's not inferior to the imported, to the chemical product like omeprazole to pantoprazole in terms of increasing the pH of the gaster, because when you have a lot of hyperacidity, the gaster actually lowers the pH. We need to increase it. And this natural product, cinnamon, is not inferior. In fact, it is superior to the drug that's been taken by many people, omeprazole. So also this is an example of what we did in the clinical trial. Another clinical trial, we go head-to-head, directly head-to-head. The chemical product like omeprazole versus biodiversity green pharmacy product like Redacid. And again, look at the result. The green pharmacy product, Redacid, is not inferior. In fact, it is a little bit more superior to the imported chemical item. So this is just an example. This is only one because of the time. I cannot show many data which we have. We have like 12 to 15 products as our clinical trial has gone through publication and so on. But this is an example of how a good green pharmacy product, great design, can also replace the chemical product, which actually decreases the amount of importation, but also friendly to the environment as we spoke about. Now, earlier, Dr. Rizka has already alluded that we have the governmental national formulary, but still only have 5 phytopharmaca in there. We need to increase to 20 to 30 phytopharmaca. Yet, in order to make phytopharmaca, we need a lot of commitment in terms of development, as well as from the regulator, making it easy to register phytopharmaca so that we can have more than only 5. This is again multi-departmental, so that everyone work together to make sure that the green pharmacy being used, not only 1.3% of the prescription, not only 3%, but we need to increase up to 40%, even 50% of prescription in Indonesia in the future. That said, our group, DESA group, has already been producing phytopharmaca since 2011. In fact, the first phytopharmaca is Stimuno. It was given 2005. But subsequently, 2011, we start making more and more phytopharmaca. And yet, when we look into the prescription of 1.3% in Indonesia, the drug that we produce from the green pharmacy is not being in Indonesia, but lo and behold, it is highly regarded in many other countries. For example, in surrounding countries, in Philippines, in Vietnam, in everywhere, the doctors have been prescribing our phytopharmaceutical product, green pharmacy from Indonesia, which not been prescribed by Indonesian physician. This is something that puzzled us, but yet this is the reality that we need to work on together, just to make sure that everyone, every physician, every pharmacist, they really know the use of the green pharmacy, they use it in the prescription basis, and we all be happy, but from the farmers to the manufacturing to the patients, because green pharmacy saves lives, it cures diseases, increases the quality of life. Thank you very much, ladies and gentlemen, for your attention.